The topic is MERS coronavirus. Is an infectious disease caused by the eponymous genus coronavirus virus, which was first identified in 212 in Saudi Arabia. Virus infection present with severe acute respiratory disease that cause fever, cough, pneumonia, respiratory distress, renal disease, and a high mortality rate close to 30%. A small percentage of those affected have mild respiratory disease.
Into the Kingdom of Saudi Arabia, and you have developed a slight cough. You snuggle into your sofa with a bowl of chicken soup and turn on the evening news. To your surprise, the top story highlights recent panic over a new deadly viral infection called Middle East Respiratory Syndrome, MERS or MERS. Should you call your doctor? Should you call an ambulance? Or should you simply tuck yourself into bed after 2 ibuprofen tablets and ignore the news altogether? Like any self-proclaimed medical genius, you search the internet for appropriate YouTube videos on the topic of MERS to alleviate your concerns. Apparently, Middle East Respiratory Syndrome is caused by a coronavirus, which is a large family of viruses that cause disease in humans and animals. This is the same class of virus that caused severe acute respiratory syndrome, or SARS, in recent years. MERS was first detected in April 2012. Infection with MERS causes death in about half of cases. Okay, that is frightening. You read on. The symptoms of MERS include cough, fever, and shortness of breath. Severe cases may progress to pneumonia and may include diarrhea, kidney failure, and death. There's that word death again. Now you feel a little nauseous. As the name implies, the origin of the virus seems to be the Middle East, including your recent vacation spot, Saudi Arabia. Recently, there have been documented cases in Europe, and as of May 2014, the United States had 1 documented mild infection. These cases occurred in people who had recently traveled to the Middle East. Scientists investigating the origin of the virus believe that it may have originated from domesticated camels. You recall several fun nights of disco dancing with Marcus the camel and begin to have some regrets. On a more serious note, MERS coronavirus can be deadly, but let's keep things in perspective. First of all, most strains of coronavirus are mild. Some strains of coronavirus cause the common cold. You have likely had a case of coronavirus yourself. Other common viruses, such as influenza, can also be very severe at times. What makes MERS potentially dangerous is the fact that it is new to humans. It is rare for viruses to pass from animals to humans, and the human immune system may not be prepared for such a novel virus. There is no specific treatment for MERS, but fortunately, most cases passed from person to person are mild. So far, spread of the virus has been very slow. So unless you are a doctor or a nurse that recently cared for patients in the Middle East with known cases of MERS, your cough and fever are probably caused by another virus. But don't take my word for it. Talk to your doctor if you or Marcus develop any unusual symptoms.
Remember, to all you sofa doctors out there, diagnosing or treating anyone based on internet videos is generally a bad idea.
We investigated a case of human infection with Middle East Respiratory Syndrome coronavirus after exposure to infected camels. Analysis of the whole human-derived virus and 50% of the camel-derived virus sequence yielded nucleotide polymorphisms, signatures suggestive of cross-species transmissions. Camels may act as direct source of human MERS-CoV
That's causing concern around the world. It's extremely rare but deadly, and now scientists believe it can spread through close personal contact. In northern France, 2 men are being treated in intensive care. A 50-year-old man contracted the virus after sharing a hospital room with another infected patient. The World Health Organization is investigating other cases like this in the Middle East.
Of most concern, however, is the fact that the different clusters seen in multiple countries increasingly support the hypothesis that when there is close contact, this novel coronavirus can transmit from person to person.
So far, there have been 34 confirmed cases of the virus since it emerged last year. Of these, more than half of the patients have died. Most of the infections have occurred in Saudi Arabia and in a number of nearby countries, but the virus has since moved further afield into Europe. It causes a high fever, breathing difficulties, and can eventually lead to organ failure. Experts are now racing to find the source of the virus and to learn more about how it spreads. In its current form, it's not contagious enough to start a pandemic, but with its high fatality rate, it's a threat that health officials are taking seriously. Rebecca Morrell, BBC News.
This coronavirus strain had not previously identified in humans. So far, only it described a small number of cases, and data transmissions, severity, and clinical impact are greatly reduced. Last update of the WHO about this virus. April 40, who has been informed of another 16 confirmed cases of infectious respiratory syndromes coronavirus that causes the Middle East in Saudi Arabia and the UAE.
In the UK brings the number of global cases up to 12. So this potentially fatal SARS-like virus was first identified in September of last year, and experts now say they would not be surprised if it came to the U.S. Senior medical correspondent Elizabeth Cohen joins us now. So Elizabeth, explain this to us. How dangerous is this?
You know, this virus is particularly vicious, John. You talked about 12 cases. Well, 5 out of those 12 have died. That's a relatively high mortality rate. People are getting things like pneumonia and kidney disease. But, and here's an image that we got actually right from the authorities in the United Kingdom. So that's the bad news about the virus. The good news about the virus is it's actually hard to get. It's thought that people are getting it from animals, but then once it gets to people, it's not spreading, from what we can tell, person to person to person to person. You're not seeing long chains of transmission like you do, for example, every year with the flu. It is possible that there has been some person to transmission, but it's been very limited, and so far they think that they've only seen it among people who are living in the same household. So for example, they're not seeing people getting it by say sitting next to a sick person on an airplane. So that's good news. Bad virus, but also really hard to get.
Elizabeth, we did call it a SARS-like virus here, and that doesn't sound good. So talk us down here. How scared should people be about this?
You know, the experts I talked to said people should not freak out. Those actually were their exact words. They said, again, we're not seeing, say, someone get on a bus and then the rest of the bus gets sick. That's not what's happening. What we have seen so far is that this appears to have started in the Middle East, and now we're seeing these few cases in the United Kingdom. But again, you're not seeing long chains of person-to-person transmission. Now, these same experts said, you know what? Wouldn't be surprised if it came to the United States, given the high volume of global travel, but it is possible.
Global health officials have questions and concerns as well about a newly discovered virus called the novel coronavirus. Cases have been reported across parts of the Middle East, especially Saudi Arabia, in Britain and France, where a person who shared a hospital room with an infected patient has now tested positive as well. That's worrying. Senior medical correspondent joining me now. So if a person sharing a hospital room with someone who's infected develops the disease, does that suggest that it's going from person to person, yes?
Well, Hala, we already knew that it was going from person to person because there was suspicion that family members were getting it from each other. So while hospital mates are not family members, they are living in the same room. So again, they suspect that they have seen this virus go from person to person among close family members and now also in the hospital setting. So while that's certainly worrisome, I would also say we're not seeing it among people who, say, sit on a bus next to each other for 15 minutes or pass each other in an airport or are shopping near each other. You know, I think that's an important distinction to make. And when you see these numbers, I think you'll see what I mean. So this virus was first identified in September of 2012, and there have been 34 infections since then. 34 known infections, I should say. If this were spreading like wildfire, we would have seen a whole lot more since it's been around since September. However, here's the number that I think doctors are finding especially troublesome. 18 deaths. That is more than a 50% death rate. That is very high. So when people do get infected, it appears that they get very, very sick, and have a relatively high chance of dying. A 50% mortality rate, Hala, is very high. And most of the people who we've seen get sick with this virus, they tend to be elderly men who already have some sort of, often they have some sort of underlying health condition. Hala?
So should people be worried? I mean, because you're saying that if it was spreading like wildfire, we'd see many more people infected, but should just ordinary people, you, me, others watching us right now, traveling to those parts of the world, have any level of concern?
You know, I think if I were in one of these countries where we've seen this virus and I was in a hospital room next to someone who had pneumonia, I would ask the question, could this person have the novel coronavirus? I mean, I would ask that question. And you'll see why it's called the coronavirus there. It's got that kind of crown around the edge of it. But the doctors I've talked to have said, look, the average person does not need to be worried about this on a day-to-day basis. If my husband went to one of these countries where the virus is present and came home and he got an infectious disease and then I got some kind of an infection, I would also be worried. But, except for those circumstances, doctors are telling us this isn't something that your average person needs to be terribly worried about.
His father died after a chest infection that quickly worsened into kidney failure. Soon after, other family members fell ill too. Doctors now believe it was the new deadly coronavirus.
Well, the first time they told me I have corona, the first things I thought about is I'm gonna die. Because I thought about my dad and I said it's going to be the same case and I'm gonna lose my life.
This is NCOV, and the World Health Organization is monitoring it closely, especially now that human-to-human transmission has been verified between patients and from a patient to healthcare workers. Doctors from the WHO are in Saudi Arabia to monitor the spread of the virus.
Of most concern, however, is the fact that the different clusters seen in multiple countries increasingly support the hypothesis that when there is close contact, this novel coronavirus can transmit.
Now, according to the Centers for Disease Control, this is where the virus was first detected in April 2012, Saudi Arabia. Then it spread to other countries in the Middle East, including Qatar and Jordan. Now, by February of this year, travelers to the Middle East had brought the virus to Europe. France, Germany, and the UK all reported mostly isolated cases. Now, there have been at least 40 confirmed cases, and 20 of those patients have died. The largest cluster is in Saudi Arabia. Doctors say anyone with sustained daily close contact with an infected person is at risk of contracting the virus. There is no evidence yet that it can be passed on through casual contact, but health authorities are keeping a close watch for any indication that it could spread more quickly.
The nurse have to take precaution against droplet transmission to attend any patients with symptoms of acute respiratory infections, in the case of a confirmed or probable MERS-CoV infection case, and precaution against contact and precaution against airborne transmission are indicated when aerosol generating procedures are performed.
Middle East respiratory syndrome virus has infected at least 3 people in South Korea. A disease with a fatality rate of 30 to 40% has infected 3 people in South Korea after one man was diagnosed with the virus after a trip to Bahrain, Saudi Arabia, and the UAE. South Korean officials on Thursday confirmed the country's 3rd case of Middle East respiratory syndrome, also known as MERS. The MERS virus, a SARS-like respiratory virus, may have originated in bats. Both bats and camels are thought to be carriers of the virus. Humans may pick up the virus by inhaling particles in the air or through self-inoculation. Once inside the body, MERS targets cells in the lungs. Enzyme receptors called DPP4, located on cells deep in the lungs, are thought to act as virus receptors. The receptors are located in 20% of the lung's epithelial cells. Once the receptors and the virus bind, MERS fuses with the host cell membrane and enters the cell. The virus has an incubation period of up to 14 days. Bats, various primates, and many domestic animals have the same enzymes in their lungs, which means that the virus could easily jump between different mammals. A South Korean man diagnosed with the disease after returning from a trip to the Middle East passed the disease on to his wife and another patient. 64 others have been quarantined. The MERS virus does not transmit easily between humans, and there are existing uncertainties about how it's actually transmitted between humans. There is no cure for the virus yet.
Leave an insightful comment on tomonews.net, and you could win up to $500 every month.
This data to recent findings showing high similarity of MERS carried by humans and camels, supporting the hypothesis that humans' MERS infection might be acquired directly from camels. In addition, but animals that show signs of infection were juvenile, which provide further support to previous findings that mainly young animals are infected by MERS coronavirus, given the synchronized partner of dromedary camels with birthing in the winter months. An increase of epizootic activity might be expected after some latency during the first half of each year.
The MERS coronavirus, dubbed a threat to the entire world by the World Health Organization this week, has killed 3 more people.
The 3 latest victims of the new SARS-like respiratory virus died in a hospital in Saudi Arabia's capital. Health ministers say they ranged in age from 24 to 60.
This is of grave concern to us here internationally in WHO because there are so many unknowns around the virus, which so far has killed 55% of the confirmed cases.
All of the 3 recent patients had chronic diseases and were admitted into the hospital months ago. The 3 deaths bring the most recent global death toll from the Middle Eastern Respiratory Syndrome, or MERS, to at least 30. A number of others have become sick with the virus. There are no reported cases of the virus infecting anyone in the United States yet, but the virus, which is believed to have originated in Saudi Arabia, has been reported in France, Germany, and the United Kingdom. The symptoms of the disease are flu-like, beginning with a cough and chills, but then becoming increasingly worse. Scientists believe it can also be transmitted by human-to-human interaction. The disease is believed to be part of the SARS family, which spawned another worldwide outbreak in 2003.
One case of SARS in a Hong Kong hotel in 2003 infected 12 other hotel guests who flew out of Hong Kong. Within 9 months, there were more than 8,000 cases all over the world.
Like SARS, the new disease is believed to have originated from bats. It's believed to be more difficult to transmit than SARS. For Newsy, I'm Candace Avilés.